So we're presenting at this conference phase 1/2 study with a combination of a bromodomain inhibitor, BET inhibitor with Talazoparib, which is a PARP inhibitor in triple-negative breast cancer that is BRCA wild type. So we know that we have the approval of PARP inhibitors in metastatic breast cancer with BRCA mutations, and that these mutations, when they're germline, they're enriched in triple-negative breast cancer. The goal of the study is try to expand their use, and there is preclinical data published in breast cancer, but also ovarian cancer, where treating with a bromodomain inhibitor that targets tumor epigenetics can induce BRCAness. So it's a phenotype with a loss of function of BRCA without the mutations, potentially rendering these tumors sensitive to PARP inhibitors. So, and as we know that triple-negative breast cancer is an unmet need, we decided to do the study in this setting. So this is a phase 1/2 study with a BET inhibitor called ZEN-3694 in combination with Talazoparib. So as we hadn't used these agents first in combination, we had a dose finding portion that had 15 patients, but at effective doses. And then the dose that we decided to expand was for the BET inhibitor 48 milligrams a day, and for Talazoparib 0.75 milligrams a day, a little bit lower than the 1 milligram a day that we use in monotherapy. The study was then expanded. 37 patients in the expansion cohort. So patients with triple-negative breast cancer that was metastatic were enrolled. They were pretreated. So I think 44% had received the checkpoint inhibitor in combination with chemotherapy, and patients had also received multiple lines of chemotherapy. The primary endpoint was looking at the clinical benefit rate and the objective response rate. So we had an objective response rate of 30%. And if we looked really at the patients that were triple negative at diagnosis and not losing the hormone receptors, it was a 38% objective response rate. The main adverse event, so the main toxicity was thrombocytopenia. So this is a known adverse event of both agents. At the recommended dose, we had the grade 3 thrombocytopenia in about 22% of patients, managed with dose reductions, dose discontinuation, so we had experience with that. And there was only one grade 4 event at these doses. Now we also looked at some pharmacokinetic and pharmacodynamic biomarkers both in blood and in tissue, so we had paired biopsies, and we saw that actually we were hitting the target, meaning that giving the bromodomain inhibitor was really inducing this BRCAness phenotype with a decrease in the expression of HRD genes. So the results are quite interesting, and we might move forward with that. After discussion with regulatory agencies, since these patients had not been exposed to one of the new agents in triple-negative breast cancer, Sacituzumab govitecan, we are expanding the study with a new cohort after Sacituzumab govitecan, and based on these results, the combination might move forward maybe in a registration trial.